A lot of the families are saying that they feel like the sole focus is on the baby, and some of the focus should be on the baby, but what about strengthening the mom and the dad? Like, are we caring for their mental health? Yeah, a lot of families look we're I was lucky enough at Georgetown, we had a psychiatrist that rounded once a week, but her salary initially was funded by a nonprofit. But she took the time, she listened to my husband and I, and kinda gave us a different perspective of how to view things, and sometimes you just need to vent, and she was there. So at the bare minimum, families need a social worker or a psychiatrist, mental health provider, just to make sure mentally they're doing okay. Because if you're sending these parents home depressed, how is that affecting their child? So at the bare minimum. And then resources. So, like, why are they paying for parking every day if they're in the hospital for 6 months? Why are we depleting their bank accounts or not providing food so that they can have a little bit of a nest egg when they come home? So families have to feel empowered to ask for what they need if it's not being offered. So, for instance, Colin was in the NICU for 6 months. And especially like when my husband and I, we both transitioned back to work, there was a lot of stuff that was lost because we weren't able to make it to rounds every day anymore. And so then you're calling, you're trying to get updates. And my son saw like multiple different specialists between neurology, neurosurgery, GI, so on and so forth. And so then we had to like advocate where we ended up having like a weekly meeting every Thursday. And it's, the nurse, the attending, the social worker, so on and so forth, they were there. And so we can ask the questions. My husband dialed in, I was there in person. We can ask the questions like, okay, what is going on? This is what we need. Like, what's the plan? So we kind of felt more empowered or more like aware of what's the plan. So we knew what the goal was to reach for or reach towards. For me, what really helped is I started scouring the internet for different resources as far as support groups. So I knew what questions to ask. I knew what other families had that I didn't have. So I can go like, they have this. Why don't you offer me this? Like, what do I need to get this? So it's like if your hospital isn't giving, it's like kind of up to the parents to find a way to get what you need and kind of demand it.